Welcome to the Physician Associate Podcast.
Hello, my name is James. Welcome to this episode of the Physician Associate Podcast.
And I'm really delighted today to be joined by a truly very special guest. Welcome to the show, Hayley.
Hey, thank you so much for having me. My name is Hayley Arceneaux. I have been a PA for 6 years, and now I do pediatric oncology, currently practicing at St. Jude Children's Research Hospital in Memphis, Tennessee.
Really excited when I found out about you and your story and the adventure that you've been on. I thought it'd be great to celebrate all of that and promote what physician associates can do.
Absolutely.
Do you want to start by sort of telling us where you grew up?
I grew up in Louisiana in a very small town, and I had a very normal childhood until I was diagnosed with cancer at the age of 10. I had been having some pain in my leg, and I was also doing martial arts at the time. And the initial doctor we saw thought it was an overuse injury from the taekwondo. But then I started limping, and at that point, my mom noticed I had a new lump that had formed above my left knee. It was in my distal femur, and we went to see another pediatrician, and I had an X-ray, and from that X-ray, she could tell it was osteosarcoma. And getting that news was very devastating. It was very shocking. And I immediately thought I was going to die. But we found St. Jude Children's Research Hospital. And a few days later, I was walking in the doors of the hospital. And once I met the staff there and my team, I really felt hope. And I felt like I was going to be okay. And so I spent a year in treatment there. I had chemotherapy, and then I also had surgery, a limb-sparing surgery that saved my leg and replaced the affected part of my femur with an internal prosthesis. And that year really made me who I am in so many ways. And it also changed my career aspirations. I knew I wanted to work at St. Jude and help other kids going through cancer treatment. And right before I entered college, I found the PA profession. I had shadowed different members of the medical team, but I really liked the role of the PA as someone who could make medical decisions, but also have more patient interaction. But yeah, then I became a PA. I worked in emergency medicine, and then I got my dream job about 2.5 years ago. And I love working with the kids of St. Jude. They are absolutely precious, and they really just bring me so much joy.
What does a normal day look like for you at work day to day as a pediatric oncology PA?
I work in the inpatient setting, so I work 7A to 7P. I get there and get my patient assignment at 7 a.m. and go through their vitals, labs, overnight events, and of course why they're there. Come up with a plan, and then at 9:30 in the morning we do rounds with our attending physician, the hem-onc fellow, and then we have our nursing team, the nutritionist, the pharmacist, and so I present the patients, go over the plan, and we discuss each case and then implement the plan. And so I spend the rest of my day calling consultants, doing discharges, admitting patients, and of course, discussing any results with the families.
The PA profession is much larger in the States, much more established, and has been going a lot longer than it has in the UK. I think there are maybe 1 or 2 PAs in the whole of the UK that work in paediatric oncology.
Oh, wow.
Is there any resistance, or is there any trouble being a PA, or is it just quite well accepted now?
I think it's very well accepted, and kind of the medical model in the US is really dependent on APPs, advanced practice providers, so PAs and nurse practitioners, because we've been able to fill this role, especially with the aging population, and they've needed more and more healthcare providers. And so even working in the adult emergency room, I rarely met any resistance, especially because I graduated PA school at 24 and I looked very young. And I remember some patients, especially the older ones, they would say, "Are you old enough to be doing this?" And I would say, "I'm smart enough." But I think people were just so grateful to have help that I very rarely met any resistance.
You must have flown through undergrad then and PA school to finish at 24. Yeah.
I knew exactly. It helped that I knew exactly what I wanted to do. And so I spent 4 years in undergrad, and then I graduated college on a Saturday and I started PA school that Monday.
Whoa, there's no stopping you.
It was very intense. I don't necessarily recommend that, but I enjoyed having my career at the age of 24 and getting to do what I wanted to do.
Is it very competitive to get into PA school? In the UK, it's increasingly recognised, and perhaps a few years ago wasn't as well known, and it's much more competitive to get into now with entrance exams and.
Great. It should be competitive. It's a really hard career. And PA school is grueling and in the best way. We have to be really well prepared to take care of these patients, but PA school is extremely competitive in the US. And of course, high you need to have great performance on the standardized test. We use the GRE, great grades in undergrad, and then also more and more they're looking for some patient care experience. It usually ranks very high on best careers in the US. It was number one a few years ago, but I'm meeting a lot of students who they want to go into medicine and they just think that doctor is the only option. And so I always try to educate them on the role of the PA because somebody had to do the same for me. I initially thought I wanted to be a doctor, but then whenever my mom told me about the role of the PA, and that's when I shadowed both, and I realized that that PA would be a better fit for me. And so I try to encourage the same. And some people are destined to be doctors, and that's amazing. And some people are destined to be PAs, and you just have to find what fits for you.
Are there several PAs in your department? Is it a growing profession across your hospital?
We have a ton of advanced practice providers at St. Jude, but most of them are nurse practitioners. But there are some PAs. It kind of depends on the specialty and where you practice, if there's more PAs or nurse practitioners. But we have a PA presence for sure.
And is it a rural kind of setting, or are you right in the middle of a city in St. Jude's? Or
we are in the middle of a city, and working at St. Jude is a premier institution for pediatric oncology, and so we have accepted patients from all 50 states and from all over the world, and so we have it's a great diverse population, and we stay busy. We have these wonderful families that we get to take care of, and we absolutely love them so much.
Oh, fantastic. That comes across in the way you're speaking about it. You can tell how passionate you are. I take it your colleagues know you and your story from being a child, being a patient yourself there?
Yeah, and it was something I even brought up in my interview whenever, the question came up, why do you want to work at St. Jude? And it truly has always been my dream job. It's all I've ever wanted to do. And I don't always share it with the patient families because whenever I'm interacting with them, our interactions are about them. And so addressing all their needs. But if I do think that a patient or a family would benefit from hearing it, at that point, I will share it with them too.
You never quite know when you're having an interaction with a patient that you can kind of inspire them sometimes. And I know a few PA students who've been treated by a PA and then have gone to PA school as a result of that meeting.
Oh, yes. You never know the impact you have on patients. And I know that from being a former patient, and now that I've kind of gone back and told a lot of the people who treated me how much they meant to me and how much they've inspired my journey. Some of them have said, like, I had no idea. It's cool to be able to share that.
What are the most challenging bits about being in your role?
I think the most challenging part, and this isn't necessarily being a PA, but just working in pediatric oncology is, childhood cancer doesn't have 100% survival rate. Kind of navigating those difficult situations and, trying to do everything that we can for the families and the patients to support them. But those could be the most difficult days.
Yeah, I can imagine. Let's see.
I was working at my dream job, and I kind of thought my life had peaked. And they were having this fundraiser for St. Jude. It was the first all-civilian mission to space called Inspiration 4, and it was being used as a fundraiser for the hospital. And they really shocked me when they called me one day and asked if I wanted to be the ambassador for this mission and go to space. And so then I went through, of course I said yes, by the way. And then I went through about 6 months of astronaut training, and then I went to space. I was the medical officer for the mission. So I went through some specific medical officer training, really learning the physiologic effects of zero gravity on the human body and what we could do about that. And then I went to space in September of 2021. and became the first PA in orbit among some other firsts. But it was the most incredible experience. We spent 3 days in orbit, and it's something that absolutely changed my life, changed my perspective.
It's just mind-blowing, isn't it, to think that can be on offer.
I know. And I know it's not anything I applied for. It's just, so you can imagine how absolutely shocked I was to get that phone call.
Was there any hesitation in saying yes, or was it immediate, yes, of course I'm going?
I recognized what an incredible once in a lifetime opportunity this was. And so I did not want to say no. I did say, let me check with my mom first to make sure that she's not adamantly opposed. But I knew my family would be really supportive. And my brother and my sister-in-law are both aerospace engineers. And so they also were able to answer a lot of questions for us and give us a lot of peace of mind about the safety of space travel.
Can you talk me through what your preparation was like and the training and what you had to go through to get to that point?
It was mostly academics. A lot of studying went into it. We really learned about the ins and outs of our spacecraft and what we'd be doing in space. And then we spent significant time in the spacecraft simulator at SpaceX. We practiced what it would be like if everything was going well in space. And then our trainers would put us through situations where things were going wrong, and we had to work through that. And then we did some of the classic astronaut training. We did centrifuge training and fighter jet training to be exposed to high G forces that we would experience with launch and reentry. We went through water survival training, hypoxia training, and we climbed a mountain together as part of our crew bonding.
Wow. So they really did put you through your paces.
We were civilian astronauts, but we were highly trained because we were going to be in this spacecraft orbiting the Earth for 3 days. And we had to really know what we were doing and be prepared for any possible situation that could arise.
And it's worth pointing that out again, I guess, isn't it, to the listeners, that there wasn't somebody from NASA or SpaceX or somebody there with you.
We were 4 trained astronauts, but we didn't have a professional as far as a government astronaut with us.
Amazing. Absolutely amazing. What were those 3 days like? What view did you have? What experiences surprised you?
We were so well prepared from training for about every aspect of our mission, except for seeing the Earth. It was incredibly beautiful. It was very shocking to see our planet. And our spacecraft flew this giant dome window that was the largest window that had ever been flown in space. And from it, we could see the whole 360 of the Earth all at once, with the blackness of space around it. And we weren't expecting to get quite that view. And part of it was that we were so high in altitude. We were higher than the International Space Station, higher than anyone has gone in the 21st century. And so having that view and having that window and seeing the Earth in its entirety was very shocking, but it was just so incredibly beautiful. And the whole experience was just amazing. I loved zero gravity. I loved doing flips and just being off the planet and kind of looking back at it and knowing that everyone I loved was on that planet. It was just such an incredible experience. And I feel like I'm so fortunate to have had the experience. And when I went to space, less than 600 people, all of human existence, had ever gotten to see that view. And that was less than 70 women. And so it really weighed on me how fortunate I am to have been able to experience that. And
as the first physician associate to make it into space, you were responsible as chief medical officer for the mission. All smooth sailing? Did everything go well?
Well, we all had a degree of space adaptation syndrome, and 2 of my crew members got space motion sickness. And so I gave them IM shots of Phenergan, which I was pretty excited about because, PAs, we typically don't give IM injections, but it was really difficult in zero gravity because drawing up the medicine from the vial, the medicine was floating around the vial. And so I'm trying to chase it down with the needle. And every time I draw it up, it's full of bubbles. And so they did feel a lot better after those shots. But we all did have a degree of symptoms of just being in zero gravity. We hit 4.5 Gs coming down, so 4.5 times the amount of Earth gravity. But it felt a lot more intense because we'd had those 3 days of 0 Gs. From my window seat, I could see these flames on the window. as we were coming through the atmosphere. And you know, at that point we just had to trust that everything was going to go well. And it did. We splashed down in the ocean, and it was really wonderful after we got back to Earth, because just a few hours later, we found out that we had surpassed our $200 million fundraising goal for St. Jude. Through our mission, we raised about $250 million for cancer research and for the hospital. And so really everything was so worth it in so many ways.
Oh, that is amazing, isn't it? What a legacy to leave.
Yeah, just knowing it's going to help so many kids around the world.
And knowing you were probably straight back to work like the next day?
Not quite the next day, but I was very eager to get back to working with my patients. And it was really special. In orbit, I was able to call some of the St. Jude patients, and we had this live call, and they were able to ask us questions, and we gave them a tour of our spacecraft. And then I was able to just give them the message of, if I can do this, you can do this.
Incredible. Absolutely incredible. It's almost been a year since your spaceflight. How has it changed you? What has it left you? Has it given you a new perspective or?
Absolutely. I think it's changed my daily life. And when I was up in space and looking at the Earth, I was just really overwhelmed by how much gratitude I felt. And that gratitude is going to stay with me for the rest of my life. And, you know, I also was struck by the fragility of our Earth. And so I've been much more environmentally conscious, and just really also trying to share that. But really, I just want to continue sharing the experience with other people, and hopefully empowering these kids fighting cancer, or anyone going through something difficult, that, you know, there will be better days ahead of you, and better days than you can even imagine. I could never have imagined that not only would I survive my cancer, but I would also become a PA and an astronaut. But I think that's the beauty of life, is you just don't know what's going to happen.
Amazing. What comes next? Have you got any plans? Are you straight back to work, or?
Well, I'll continue working at my dream job, I imagine, for the rest of my life. And I wrote a book. It's a memoir. It's called Wild Ride, a memoir of IV drips and rocket ships. And it goes through my life, surviving cancer, and of course, becoming a PA, working my dream job. And then I really detail the experience of getting to train and go to space, and what that was really like, especially for a regular person to go through that. And I have some more books on the horizon. I have a version of that book coming out for young readers. And so that version will come out. And then I have a children's picture book in the future as well. And then I'm in my free time, I'm really enjoying exploring our planet. There's so much to see, and I have just this greater love for Earth than I ever had. But I've just been exploring, going to other countries. I'm going to Antarctica in a few weeks, and I just really want to see as much as I can.
Oh, wow. Fantastic. That'll be another world as well, I imagine.
It will. It will be incredible.
Brilliant. Thank you, Hayley. Thanks so much for joining me on the podcast, and what an amazing story. Congratulations on all your success. It's just fantastic.
Well, thank you for saying that. And I enjoyed speaking with you today.
If people want to find out more about your adventure, where would you point them to find out?
My memoir, Wild Ride, is it really details my adventure. They can follow me on Instagram and Twitter. And then we also have a Netflix documentary, a docuseries. It's called Countdown: Inspiration for Mission to Space. And so if they want to watch our journey, they can follow that as well.
Perfect. Thank you. I'll leave links to your book and your social media and the Netflix docuseries in the episode notes so people can find it there. It's a really good series. I've really enjoyed watching it.
Oh, I'm glad to hear that.
And thanks to you for listening as well. If you've got an idea for a future episode of the PA Podcast, I'd love to hear from you. You can get in touch with me at PA Podcast UK on social media. And I hope you'll join me again for the next episode.
Thanks for listening to the Physician Associate Podcast.